Happy December 2025, Montgomery County Fire and Rescue Service. It's the monthly Fire Chiefs meeting. Today we have with us both Assistant Chief Kaufman and Assistant Chief Fabrizio. We're going to get into a little bit of operations. Before we start, though, I just want to remind everybody that it is the holiday season. We already have had some incidents that space heaters and things like that. We also ran the director of ABS house in Silver Spring earlier, where she had one of her EV vehicles actually caught fire in the garage. So there's a lot of risk out there that we're dealing with and hazards that we'll get into how we've been doing in that space. But as it relates to the holiday season, please be responsible when you're out there. Enjoy your family. Make sure that we are able to touch base with our community anytime we're on the scene to educate them on how to be safe. And then we also have resources through our 311 community risk reduction, as well as community action coordinator team to go and do tailored prevention with them. So please let the community know about those resources. Really quickly, the class announcement will come out on the week of January, 2020, the beginning of January. So please, we all are recruiters. Tell everybody about our great department so that we can continue to do the great recruitment that we have been doing very recently. As it relates to, I want to thank the County Executive's Office and County Council. There are two things recently we've been working on. The HEROES Act is one, and it has to do with line of duty death. So there's been a lot of work behind the scenes from our teams at Burtonsville, shifts at Burtonsville, from our union, IFF 1664, also Battalion Chief Robinson, and so many others. And I'm happy to say it came out of the Public Safety Committee, and the week of the December 8th, it'll go to the full vote of council. So we're making progress in that space. Also, the same week, they'll vote on a supplemental budget request for the Joint Operations Center with ourselves, police, as well as OEM for a tune over $2 million. So we're already moving in that direction. And we'll talk a little bit more about the JOC when we open up the discussion. So I just want to say, I'm still so proud to be a part of this organization, to work alongside each and every one of you. We've done some amazing things. We're working with 1075 to put something together from a year in review so that we can share all the great work that we've done together and just keep being safe out there and doing the right thing, and I appreciate each and every one of you. So let's start with Chief Fabrizio. Can I talk about a little bit what you're seeing out there from operations?
Yep. Just like every day, our men and women are performing above par. They're doing really well. We have our quality assurance program still in development that's rolling forward. We are slowly growing that. We now have the group. They're actually going out and doing interviews with unit officers, with incident commanders. They've been listening to audio. We've been asking for feedback on where there have been some challenges and some issues that we may need to focus on. And they've also been passing on a lot of the success stories that we've had. The last month has been fairly busy. We've had 13 fires. Our time from dispatch to on scene is averaging about 5 minutes. Our crews are doing wonderful work with getting water on the fire quickly and getting primary searches done quickly. That information is allowing us to figure out where we need to maybe tailor our training, working with AST, working with the academy to focus on some of those points. We also want to start expanding our quality assurance program into other areas outside of fire. We've had some informal discussions with special operations. We're going to get into them and talk to them about their work on the river, what some of the data points and some of the metrics that we need to start measuring there, and figuring out what tools, what training we can develop to help them with their mission. But we're seeing a lot of good work. As you noted in your introduction, we're seeing a lot of issues with space heaters. As you said, the space heaters need space. We need to remind the community of that. We're seeing a lot of electrical issues with overloaded power strips and extension cords and whatnot. So we had a great opportunity. So Station 33 had two first due fires last month with houses that were literally just blocks apart from each other. The homeowners association reached out to us and had some concerns. They've seen obviously an uptick in activity. We were able to bring together our community risk reduction team. We were able to reach out to planning and accreditation, get some good data points. We brought out Station 33 along with Battalion Chief Mann, and everybody did a great presentation and tried to help them identifying areas where they can improve and reduce some of their risk and try to pass on some good safety message and education.
Tell me about the new app we have on the waterway.
So it's CalTopo. CalTopo, we've now been exercising for the last couple months. So in October, from October till now, we've had 14 incidents on the river and the Billy Goat Trail. The CalTopo app has allowed us to either reach out to the calling party directly or plot the what three words, which gives us a very specific location. We're able to plot that into the program, and from the arrival into the general area to making patient contact, that time has decreased significantly. As well as it was just recently used on the large brush fire that we had down there that Chief Kaufman was involved with as well. It gives a great overview, accountability of units, making sure that we're using the resources the right way, the most effective way possible, and also for the safety and accountability, especially as you start getting into those evening time where we start getting dark and it becomes a little more challenging.
Can you briefly talk about what Captain Mecklin is doing in the JOC as prep and others, as well as kind of the next steps in the JOC preparation?
So the JOC, the Joint Operations Center, we have detailed Captain Mecklin from the floor to a day work position working there. He has been working with Sarah Irely, Dominic, Chief Coletti. They have started building dashboards that are going to help us with monitoring our system, give us real-time information, real-time data to allow us better use our resources to be able to provide real-time information to not only incident commanders, but unit officers and crews to make sure that they have what they need. They've been working with a lot of logistical aspects and building out the hardware of the room. And then they've also started to develop the job position descriptions, the training programs. And we just recently, last week, Chief Coletti sent out a solicitation for captains. We're looking to train the first 3 captains, get them up to speed and start exercising and, number one, evaluating our training program to make sure that it's meeting the mission and the objectives we're looking for. And then also to make sure that we can start exercising and making sure that we're good, that we're ironing out the finer details. Okay. I don't know the exact time frame, but we're hoping to make those selection within a month, okay, and then we'll be able to start that training hopefully sometime around the first of the year.
Good stuff. Good stuff on operation. Yeah. Chief Kaufman, tell us what's going on in emergency medical services.
It's largely positive. I have a lot of good updates to share. I'll start with the whole blood program. So, with a lot of energy leading up to getting the blood program, and it's already been almost a year and a half. We started this August of 2024. And to date, we've transfused 111 units of blood to 91 patients. What is surprising to those of us who kind of envisioned this program was the number of medical patients we're giving blood to. We thought a lot about trauma and penetrating trauma specifically, but about half of our patients are medical patients. And if you think about how we respond to calls, the EMS duty officers, and a lot of times ALS is not even on that first dispatch. So what's happening is the first crews who arrive are calling for those resources and recognizing a patient on a medical call that needs blood. And we're absolutely saving lives because each one of these cases is QA'd all the way through the hospital stay. So we're doing really good work there, and a shout out to the people who are running calls and seeing that benefit. I'll talk a bit about cardiac arrest because okay, you'd asked me to speak about that. It's like the biggest call we run in EMS, right? The code, the working code. So we watch this on a monthly basis, and then at the end of the year we aggregate all our data. So we're kind of in the middle of a fiscal year, but coming up to the end of a calendar year. Last month in November, we ran 75 cardiac arrests and got ROSC 25% of the time. For the last 12 months, 867 cardiac arrests, and we get ROSC 30% of the time. So, and that's about right. We're right around 30% ROSC rate over the course of a year. Beyond that, we look at outcome data from the hospitals and say, how do we do long term? Did the patients survive, and is their survival meaningful, meaning they have good cerebral perfusion and they're having decent day-to-day life, right? That is really low. That number is only at 4%. So we're trying to close the gap between the number of patients we get ROSC on, and the patients who leave the hospital having a meaningful life. So we start looking at this in the entire chain of survival. We're doing a really good job on our cardiac arrest resuscitation. We have a policy. We have decent response. We're running to the patient side to do compressions as soon as we get there. I'll put our resuscitation efforts from the time we arrive all the way through the hospital up against anybody in the country. We're doing fantastic work on the cardiac arrest side. What we aren't in control of is what happens before we arrive. So it's up to us in the fire department to influence our community and teach bystander CPR and the wonderful work our community action teams are doing with that. It's also on the 911 center to have their 911 call takers recognize the need for CPR and direct the caller to provide CPR. Because if we arrive and the patient is not, in a state that they're going to have a good recovery, then that is, that's not good. There's some rumors about Lucas devices. So the American Heart Association put out their guidelines, which they update about every 5 years. So their 2025 update included no endorsement for mechanical CPR devices. So I think the rumor got around like, well, we're going to take them away. We already knew that there wasn't a lot of data supporting heads-up manual CPR versus mechanical CPR. And that, in fact, is true. There's not a lot of data supporting the use of mechanical CPR. But those studies have not been done in the pre-hospital setting because everybody who's using mechanical CPR, I think, recognizes the benefits of that uninterrupted chest compressions at 102 beats a minute nonstop, right? Yeah. 5 for the Lucas. So we're not going to be taking Lucas devices away. But what I want to remind everybody is they're only useful when you have an entire treatment team in place, you've established the floor of care, and you have enough people to put the device on quickly within a pulse check of less than 10 seconds. So we're not looking to extend the pulse check. Your pulse check goes beyond 10 seconds, you run the risk of, you might still get ROSC, but what is the patient outcome going to be? And in terms of individual cases, we highlight a lot of these ROSC survivals at our EMS awards, and our EMS awards are coming up next month, January 5th, 6th, and 7th at headquarters in the basement. So we bring the whole team from the hospital side, the call takers, police a lot of times will respond, family members and the patients. It's one of the coolest things we do in the department. So one award ceremony each shift coming up next month. So, and then the last thing I wanted to talk about is our hospital wait times, because you see a lot of wait times in the news. Our system is strained, no doubt. We're asking a lot of our people, especially those that are riding our transport units. We're transporting typically over 6,000 patients a month. But in the month of November, what really stuck out to me is we had the lowest amount of wasted time at the hospital. And I calculate wasted time on a number of minutes after 25 minutes I'm waiting for a bed. So if the units arrived, if the transfer care time goes beyond 25 minutes, I add up all those minutes for the month and say, what was our total? Since I've been looking at this, the month of November, last month, was the shortest time we've ever had. Which is a testament to the work that our people are doing. They're advocating for our patients, they're advocating for themselves and the system overall. Also a testament to the work EMS 700 is doing and our partnerships with the hospital. They've really come through. All that being said, we're on the leading edge of what is projected to be a really bad flu season. So obviously that draws a lot of patients into the hospital with respiratory complaints, including them calling 911. So a message out to our folks would be to make sure you're taking care of yourselves with flu shots and just general hygiene. Wear your PPE on, especially respiratory complaint calls. Put a mask on, but continue to advocate for your patients and yourselves through hospital throughput times. If you get a delay, call the duty officer at 30 minutes. We don't want to see you standing there beyond, because that's not helpful to anybody. So
yeah. Good stuff happening. As it relates to the, the point of we don't know what happens before we're called and getting the best education, hands-only CPR. In our current FY26 budget, we are able to add another FTE, full-time employee position to the community action team. So that should be coming into play the beginning of next year. And Chief Cooper already put out that there's a new ambulance going in service, 726B, on the 28th, I think.
Correct,
I remember.
28th.
So we are putting our master plan into action. The science and the data is informing us. We are hot and heavy into the FY27 budget process, and I can tell you we're going to continue that effort to look at other transport units, prevention resources, and other resources to help us not only gain more of those resources to cover our community, but look at other ways to be efficient with the resources we currently have. So a lot of great things happening in that area. Is there anything else before we kind of close out?
I just want to echo or highlight, reiterate, I guess is the correct term, what Chief Kaufman was talking about with the EMS awards. When I first got up to headquarters, I had many opportunities before to attend, but when I first came up to headquarters, I had the opportunity and the privilege to sit through one of the EMS awards. And you want to talk about a grounding experience when you're able to sit down there and listen to the stories and listen to the survivors and the people that we've helped, to be able to look into the provider's eyes and say thank you. It's very easy, we all know, to get maybe ground down a little bit with call after call, but the work that we're doing is paying off and has some significant impacts. And it's a great sort of reset to say, to remind you of what the work we're doing is and how that impacts the community. So I encourage everybody to attend.
Thank you for that, because that reminded me, we also are working through the Valor Awards for next year. So the Valor Awards will go to the end of this calendar year. So if you haven't had an opportunity, you have a great incident you want to talk about and to highlight and showcase your workforce and your colleagues, please do so. And again, it could be something that hasn't happened as long as it's occurred before the end of this calendar year. So please, there's a process to go through your chain of command to submit those incidents. We're evaluating them. We want to make sure that we highlight our great things that the workforce is doing. So I echo that.
And it's also not specifically operational heroism per se in terms of on an incident.
Yeah.
Operations had the privilege of recognizing Company 2922, EMIH, and Avital in that group's work. They went out and found a family that was in distress, and it was unrelated to any sort of fire emergency or medical emergency. They were able to connect them with resources and got them out of a bad situation, a new home, resources to help them have a decent quality of life. So we don't know about that unless somebody pushes it up. And that's the stuff that's going on day in and day out that I think we as a department would love to know, to be able to tell all those people that are doing that kind of work, thank you, and that they need to be recognized. So again, please, any incident outside of what we consider day-to-day operations, please pass up.
Yeah, so as you were talking, what I was reminded of, we're also about to go into the state legislative cycle, right? So there are things that we're paying attention to at state level, whether that is specific to the fire service or one of our colleagues. So Health and Human Services, if they have some kind of significant change, we need to make sure that we are very aware of that, because as we all know, we're the catch-all. If a program is cut, then you can't get your medicine or you can't get nutritious food, then that's a health issue. And so we're doing a lot in that space, so please help us to pay attention to that. There'll be opportunities. Battalion Chief Robinson is our point person at the state level, and she's working with intergovernmental relations. We just received the federal priorities, and each agency is expected to review that. What I saw on that federal priorities list for what we're looking at was the Joint Operations Center. That was the only thing that I saw that had a nexus to the fire service. So I encourage all of us. We're 27 plus strong. So we're strong in multitude. So all of us, if we're starting to look at these things, help us identify other ways that we can go after additional funding to help us accomplish our mission. So stay tuned with that. I'm very interested in hearing. We're always a learning organization. So what other things can we do with this time every month to bring in others within the organization, others outside the organization to help educate us and provide additional tools to help us do our job. One of the people I thought of was the International Association of Fire Chiefs. Last year, we got all of our chief officers memberships. We are trying to find funding to get our frontline officers memberships, but I think there's an opportunity to explain why that's important and what the International Association of Fire Chiefs has to offer. So we're going to have that as one of our monthly highlights of a partner coming in. And I want us to cherish our traditions, but I also want us to look outside of our traditions to evaluate what someone else is doing that might not be in our discipline, but is great. So as an example, we've been talking about the Joint Operations Center. So I reached out to a lot of different people, and one of those individuals talked to me about the Joint Operations Center at Disney. I said, if you want to see how a Joint Operations Center is ran, look at Disney. So that's an example of they're not a traditional fire service entity, but they have a program that's working and that we can learn from that. So let's think outside the box when we're working with each other. And please, again, we're 2,700 plus strong. Let's talk to each other about those other opportunities so we can continue to do the great work that's going on. So, gentlemen, thank you for joining me today. As always, to our department, continue to do the great things. Be safe out there and have fun.